Hello everyone, I am Dr. Satish Babu, Senior Consultant ENT Head and Neck Surgeon working in Bangalore. Steam inhalation is definitely effective for sinus congestion for the simple reason that the steam decongests the nose and sinuses nicely. So, if done properly, you can even feel the nose opening up at the end of it, the sinuses easing off, the mucus draining out from the sinuses. You could probably sense it flowing backwards, or sometimes it comes in the front also. You can gently remove it by blowing it off. Yes, steam helps. Adding essential oils or any additives there is a personal choice. I really don't see any major advantage of adding essential oils or eucalyptus, menthol or anything in that giving any additional relief. So, are essential oils safe to use in a blocked nose, right? There are two aspects to this. One, using essential oils as a part of your steam. Another one, dropping them directly into the nostrils. I would definitely strongly advise against using them directly into the nostril, because I don't want any outside material, be it organic or otherwise, going into the nose without any scientific proof. I really don't think it works that way. Adding them to the steam probably gives a better relief even psychologically. Things like menthol give you a cooling feeling as the air passes inside and outside. So, you kind of have a better relief in the nose block and congestion if you add menthol or any such oil to that. But other than that, essential oils don't really add any major anti-inflammatory help to the person. We would strongly advise against using any oil, for that matter any moisture into the ear at any point of time. Be it water, drops or oil should not be used as a routine. We don't want any moisture inside the ear, because the ear canal is a very secluded, dark, warm place filled with dead cells and secretions and dust and all that. You add an organic oil to that, you are going to supply moisture and protein. So, obviously the bacteria and fungi will grow happily and it will create more trouble, right. You are not doing any favors to the ear by applying oil. Please keep the ears dry, don't apply any oil as a routine to the ear. It can be done in different ways in children and probably different ways in adults. But typically you need to probably bend down forward so that you don't allow the saline to trickle down into the throat or lungs in that process. So, typically bend forward a little, and depending on which instrument you are using, you are going to pump about 3 or 4 ml of saline into the nostril, allow it to remain there for a few minutes and then gently blow it out. In children, especially smaller children where they cannot blow themselves, we can use a nasal suctioning bulb. But otherwise, for a bigger child or an adult, as you pump it up, it goes inside, moisturizes, loosens the mucus. You can gently blow out of the same nostril. Whereas in Jalniti, typically the water is poured in one nostril and brought out through the other nostril, which is not required in this case, where you don't need that kind of a clearance. You just need to loosen the mucus and let it out and decongest in the process. So, pump through the same nostril, wait for a minute or two, gently blow out only part of the saline. The rest remains inside, loosening the mucus and decongesting.